Okay, joint line and meniscal windows. Find the patella tendon, place thumbs on either side of the patella tendon, follow the depression medially and laterally. This is the depression of the joint line. Okay, medial tibial plateau. Grasp the lower leg from the front with the fingers in the popliteal space and the thumbs into the depression of the joint line. Press inferiorly, palpating the tibial plateau. This is the medial side, this is the lateral side. Tibial tubercle, aka tibial tuberosity. Follow the infrapatellar tendon distally, inserting into the bony prominence, which is the tibial tubercle. Medial femoral condyle. Place thumbs in the meniscal windows, press upward on the medial side of the patella with the thumb still in the joint line. You'll be palpating the medial femoral condyle. Medial femoral epicondyle. Start on the medial femoral condyle, palpate medially. You'll feel the sharp edge of the medial condyle, and then you palpate farther medially, and then you'll be on the medial femoral epicondyle. Adductor tubercle. Begin on the medial femoral condyle, palpate medially and posteriorly until you feel bony prominence at the distal end of the natural depression between the vastus medialis and hamstring muscles. This is the adductor tubercle.
Have patient sitting with leg off edge of table. Internally rotate the tibia and palpate along the medial joint line. With internal rotation, the meniscus pokes out a little bit and you should be able to palpate the soft prominence. This is the meniscus. The medial collateral ligament, the MCL. The ligament itself is not distinctly palpable unless symptomatic. To palpate the region of the MCL, locate the medial joint line in the meniscal window. Move medially and posteriorly along the joint line. This should be the region of the MCL and will become very tender when there is a sprain. Pes and serene. Have patient sitting over edge of table. Stabilize the patient's leg by holding their leg securely with your own. Palpate the tibia tubercle. Move slightly medially and posterior. Ask the patient to attempt to flex their knee while you resist. This makes the tendons more prominent. These groups of muscles and tendons are known as the pes and serine. Just medially to the insertion under the tendon lies the pes and serine bursa. Lateral tibia plateau. Have patient supine with leg bent at the knee joint. Grasp the lower leg from the front with fingers in the popliteal and thumbs in the depression line of the joint. If you press inferiorly, you will be palpating the tibia plateau. On the medial side of the patella is the medial tibial plateau. Lateral tubercle, the large prominence of bone right below the lateral tibial plateau. Palpate the patella tendon and move laterally. Lateral femoral condyle. Have the knee flex past 90 degrees. Palpate its smooth surface right below and lateral to the patella.
Lateral femoral epicondyle. Lies lateral to the femoral condyle. Head of fibula. From the lateral femoral epicondyle, move your fingers inferiorly and posteriorly, following the joint line. The head of the fibula is at the same level as the tibial tuberosity, but is on the lateral side of the leg.
Lateral meniscus. Easiest to palpate when the patient's knee is slightly flexed. Probe firmly on the lateral joint space with your thumb, and you may be able to feel the anterior margin of the lateral meniscus. Lateral collateral ligament, LCL. Best to palpate with the knee flexed to 90 degrees and the hip abducted and internally rotated. It is a thick cord-like structure that runs from the lateral epicondyle to the fibular head. Biceps femoris tendon. Have patient prone with their knee flexed to 90 degrees. The biceps tendon is the tendon on the lateral side of the knee that comes down and inserts on the fibular head. It becomes more palpable when you resist knee flexion. Iliotibial tract, aka IT band, is on the anterior lateral side of the knee. There are two ways to palpate. First, have the patient seated and tell them to dig their heel in the ground. Second, have patient with leg fully extended.
Peroneal nerve, palpable across the neck of the fibula head.
Trochlear groove. The trochlear groove is the tract that patella glides on. To palpate, the patella will have to be moved laterally or medially. Patella, large sesamoid bone that glides over the knee joint, commonly called the kneecap. Quadriceps tendon. The quadriceps tendon runs from the end of the quadriceps muscle to the superior pole of the patella. The tendon encompasses the patella. Patella tendon. The patella tendon is from the inferior pole of the patella and inserts on the bony prominence of the tibia, the tibial tuberosity.
itself. Oh shoot.
Lateral meniscus. Easy to wow. Slightly flexed.
Trochlear groove. The trochlear.
When there is a sprain. If a defect is felt, it